Okay, folks, top of the hour here. Jeff Clark speaking to you here, Regional Director here at GoldenCare USA. Today we're doing a webinar on CSG and the Medicare Advantage season obviously coming up. And I know we get hit with so much as agents and agencies with great tools and great things to get ready for AEP and have a successful AEP. And well, this is one actually that I've seen myself. We have Anna Patrick on today from CSG. And we're doing this Medicare Advantage e-application, showing some comparison tools, some cross-selling ideas. So it's just really a great time of the year. And Anna's been with us, or been with CSG, I guess. Again, I don't know for sure, but boy, as long as I've been working with CSG, you've been there. I know you're the Director of Strategic Partnerships.
I've
Right?
been with CSG for about 4.5 years.
Okay, I was going to say 4 or 5. As long as I've known of CSG, you've been there. So, and I can tell you, I use CSG daily. Even in marketing, I kind of steer my agents into it. I just think it's an outstanding tool. Obviously, now that Integrity has bought both CSG and GoldenCare, we're kind of coworkers, Anna and I, colleagues, if you will. So, Anna, I don't want to steal too much. I know you know what you're doing, and we're going to really enjoy this. So, I'm going to turn it over to you. And you guys can type in some questions towards the bottom here, and I'll try to go ahead and maybe dip in and try to answer those, or maybe even wait till the end and we can kind of answer some of those questions. I'll verbally kind of tell them to Anna. So if you want to just type them in the questions area, I'll try to keep on top of that. But without further ado, I'm going to turn it over to Ann. Go ahead, Anna.
All right. Yeah. Thanks so much, Jeff. And thank you, everybody, for jumping on today's training. I know as we get into AEP, this is such a busy time for you. So I know your time is valuable, and I definitely appreciate your time that you spend here with me. I think it's really important for you to understand the tools that you have available on CSG. A lot of individuals that use CSG are used to just quoting on CSG, but they haven't really gotten into all of the unique features of CSG. So that's what we're going to cover, a couple of things here today, and we're really going to focus in on the Medicare Advantage. CSG recently launched the capability for you to take it a Medicare Advantage enrollment on the platform. So we're very excited about that. We also have the e-app capabilities on the MedSup and the dental as well. So just letting you know that you can complete that application. I'm going to walk through a demo here for you today. But another thing that really stands out and is unique to CSG, and no other quoting platform has this in the industry, is the opportunity to cross-sell hospital indemnity. So we have this tool that I'm going to walk you through here today on how to cross-sell hospital indemnity with your Medicare Advantage clients. It's called our Fill the Gaps tool. We're going to walk you through that, and I'm also going to just spend some time on our Medicare Advantage quoting and just kind of walk you through how our quoting process works and the different data that stands out of CSG. I know that with the Integrity partnership, most of you have access into Medicare Center as well, where you have other different Medicare Advantage quoting platforms at your fingertips. But I just want to point out and spend some time on why the CSG one can give you more data, or again, that opportunity to cross-sell that the other ones don't. So just highlighting those. I know a lot of agents will use both type of systems as well, so keep that in mind as I go through today's demo. So I do have the CSG quoting platform pulled up on my screen. Mine is branded to CSG, but you may be having yours through the GoldenCare branded tool, or if you're accessing CSG through the Medicare Center. We all have access to the same system, so everything that you see on my screen, you'll also see if you're using the other quoting tools as well. So first and foremost, we're going to spend all of our time in the newer Medicare Advantage RV2. So it says that new button at the very top. Go ahead and hit run quote. We still have the older version out there because there's a couple of features that we haven't moved over to the newer version, but everything that you're going to want to do is going to be in the newer version. So I do recommend you using that. This newer version allows you to enter in and save prescription drugs and preferred pharmacies. It allows you to do, and this happens if I have my my screen up too long without any activity. So I just reloaded the page there. So this newer version allows you to enter in those prescription drugs and those preferred pharmacies. It also pulls in enrollment data that I'm going to highlight here for you today. It allows you to do multiple plan comparisons, so you can stack different plans together to see which plan would be the best fit for your client. And then it also allows you to do these hospital indemnity fill the gaps. as well as take apps. So go ahead, make sure you're using this newer version. I'm going to start by running a quote. The first thing I'm going to do here is if you do enter your clients into CSG's Client Manager, they will populate here on the quote screen. That way, when you are ready to take a quote for an individual, it will automatically populate their zip code into the system. Anytime you run a quote for somebody and you want to enter in and save those prescription drugs and preferred pharmacies, please make sure that you have a client selected or create a client. You can do that here as well. Let's just say I was just typing in a name. You can just hit that create new client and then entering that individual's zip code there. You can adjust the different plan types, Medicare Advantage, Medicare Part D, or your special needs plans. And then you have different options for sorting as well. Monthly premium, drug and premium cost are always kind of popular options to select there. And then if they qualify for a low income subsidy level. We're still quoting the 2022 plans. As soon as it hits October 1st, we'll have all of the 2023 plans. So you will be able to change your year to 2023 at that point. You can enter in prescription drugs and preferred pharmacies and save them. So that's where we do recommend having an individual's name entered in here. So when you do go and you add those prescription drugs and those preferred pharmacies, the next time you would select that individual, their drugs automatically populate. So you can just start by typing in the drug name, the dosage amount, the packaging if that's an option, quantity, frequency, adding those drugs in. Once you add in all those drugs, you can then add in the pharmacies. It automatically populates that zip code that you ran the quote for. So then over here, you can just select any of the nearby pharmacies. You can select multiple ones, or you can search for the pharmacy up in the upper left-hand corner here. Once those are added, you can then hit Get Quote. And then those drugs and those pharmacies are saved. So the next time I would go and run a quote for Jeff, it would automatically populate those drugs and those pharmacies for me. So this is our quote results screen. What's unique about using CSG is you are going to see 100% of the market, so you can do your full comparisons. The benefits of being able to do that is just to simply answer your clients' questions that they have. Maybe they saw a commercial or a TV advertisement or had another agent talk to them about a particular plan, and you may not be contracted with that carrier. This allows you that opportunity to at least come in here and view the plan details and do different types of comparisons. So keep that in mind. We're going to show you some initial information, health and drug coverage, how many of the drugs that you entered are covered, how many of the pharmacies are covered, your premiums, your health max out of pocket, your drug and premium costs for the year are all going to be labeled here for you on the right-hand side. Now, before we get into completing an application on this system, I am going to show you a couple of things within the quoting system and then our fill in gaps tool, and then we'll get into actually submitting an application. So a couple of things I want to highlight here is when you look at these plans, you have a show plan highlights and a view plan details. If I click on the show plan highlights, this is going to give me just a brief overview of that particular plan. So it will highlight some key things like the primary physician copay, specialist copay, and then the different tiered drug costs. If I continue scrolling, and this is one thing I wanted to highlight here for you, just so you're aware of the data that we provide to you, we can see for that particular county, how many people are Medicare eligible. Out of those that are Medicare eligible, how many are enrolled within a Medicare Advantage plan, and then we can see by parent and plan enrollment. So this allows us to track how different carriers are performing, which plans are most popular, but also gives you some insight into your market. So you know in this area, how many people are Medicare eligible, how many people are enrolled within an MA plan. So as I click on the different companies, you can just see which plans are more popular or which companies are more popular than others. What's really cool is if you come in here after AEP is over, once we get all the data from CMS, so normally February, come in here and see the enrollment data between December and January and how those numbers shift. It's very interesting to see how plans performed during AEP. So being able just to have that intel is super powerful. And then the other option on here is if you click on View Plan Details. So the View Plan Details section will give you that overview of I mentioned on that previous screen. It will then show you all of the benefits and the costs. So what they're paying for their copays for each of the different services over here on the left, or the benefits. And then if I look at my RX drug coverage and costs, it will break down the different costs of the drug tiers. If those drugs were brand or generic, and what tier do they belong to. And then based upon the pharmacies that you entered, we're going to break out for you the cost, the retail cost, the before, after, in-gap, and after-gap costs at each of those pharmacies. And then it will summarize your monthly cost and your cumulative cost. We'll also let you know that coverage phase that your client will be in over on the right-hand side, so you'll know when they're in their donut hole. So all good data here. We also have some carrier resources if you need to go out and check their provider directory. We do have that provider directory link there for you, but also their formulary and their pharmacy and their website as well. So a lot of agents, again, before they go to take an enrollment, they want to do a couple of things. They want to start doing some different plan comparisons and see which plans would be the best fit for their client. So what you can do with that is maybe there are a couple of different plans that you want to compare. We have this option over here on the right-hand side with the check mark to compare quotes. Now you can compare up to 5 different plans side by side, so it does make it nice to be able to stack different plans together. And then once you select those plans, if you click on compare quote there, you can see these plans side by side. So you have your Humana and your Aetna plan, for example, and you can compare those items, same with your benefits and your costs, and then your drug coverage. So you can really find which plan is going to be the best fit. So maybe you want to pull up their old plan and compare it to their newer plan. Or maybe they said, hey, my neighbor told me about this Medicare Advantage plan that they're getting in. Can you tell me a little bit about that and why you recommended this other plan for me? You can come in here and pull up that plan and really show them side by side comparisons. And hey, remember we talked about that, you know, the different items that are really important to you, like, you know, what your emergency care would be, your hearing, your dental, all those different benefits that you said were important, and here's how that compares to that other plan that I don't recommend for you. So that's where you can really use this to your advantage on being able to pull in multiple companies and do these comparisons. The next thing that you can do within this comparison page is our fill the gaps. So this is where we start talking about cross-selling and that opportunity to talk to your clients about those coverage gaps in their MA plan. So a lot of times as you're going through and you're taking that health risk assessment with them, and you're kind of talking through things that may come up on their benefits, like their co-pays for different things. One of those items that always, especially depending on what market you're in, is this inpatient hospital stay. So in some markets, this is really high. Here in this county that I ran, if they were hospitalized, they would have to pay $350 for days 1 through 5, or $390 for days 1 through 5 on that Aetna plan. That is a lot of out of pocket for somebody, and those are the conversations that you can have. So do you have X amount of money to set aside if you were to have a hospital stay? But it's not just that hospital stay, it's everything that goes along with that hospital stay, like that maybe it's an ER visit before the hospital stay, or it's that ambulance ride to the hospital, or what happens when they get out of the hospital and have to get into some short-term recovery care. So it's not just that inpatient hospital, there's all these extra added benefits to these hospital indemnity plans. And that's why this fill the gaps tool will highlight all of those for you. So you can come up here to fill the gaps. It will automatically carry over that individual zip code. You can hit search quotes. And then from here, you can select the different hospital indemnity carriers. So there are a lot of different carriers in the market. They all kind of vary based upon what type of benefits and where they start with that benefit amount. Now, if you look at the data behind a lot of these, the average hospital stay is 3 days. But a lot of these different plans don't cover them until day 6 or day 7. So a lot of these plans are designed to fill that gap. So what you could do is you can come in here and you can select some different options for them. Maybe you do want to select GTL's three-day option. Again, a lot of you maybe contracted with multiple companies too, so you can really do different comparisons. Maybe you want to pull in the Medico 6-day benefit, or also another GTL 5-day benefit. You can select, again, your full comparison can have 5 plans. So I can go ahead, I can add those 3 plans to my comparison. And when I talk to agents about going through this cross-sell opportunity, I said the best thing about stacking these plans is you could stack the same plan. Maybe you want to do a GTL 5-day benefit. You can come in here and you can select that GTL 5-day benefit, and then come in here and fill the gaps and select that 5-day benefit again. That way you have 2 5-day benefits, and you can say, okay, here's a base plan that just covers maybe your inpatient hospital, maybe your ambulance. But then this is kind of like Cadillac plan, where it's also going to include some short-term recovery, and then some other, like a cancer rider, different other riders that you can add. So you can do the same company too, and just maybe do different comparisons and different options, but providing them that option and providing them some different ways to look at this. So how this stacks up is they have their inpatient hospital. So you can come in here and you say, okay, so for full coverage, is either $350 or $390. So you can come in here and you can select amount. Now, some agents may take this as an opportunity to also say, okay, well, if you're in the hospital, do you have any pets? And then what would you have to pay for that pet to be boarded while you were in that hospital for that 5 days? Let's add an extra $50 a day to cover those pets, your cat or your dog that may have to be boarded if you had to be in the hospital. So you can have those different conversations on, okay, if you are hospitalized, we're going to be paying you $400 a day, so that will cover your copay, but also give you some extra money to cover other items that also affect being in the hospital, right? So you can play around with these different benefit amounts. You can see what it would cost them. And then if they aren't comfortable with that overall cost, what you could then do is you could easily drop it down. So, okay, if you're not comfortable with $23 a day, let's just drop that down a little bit. So let's at least give you some coverage for $20. So I love the fact that you can easily adjust these different benefits to, as you're kind of going through that conversation with them and what makes sense. You can continue scrolling and talk about that outpatient. So if they were having to have surgery, what would that look like? Well, what would a rider look like? And then again, what does going through surgery all entail? Does it entail a ride to that facility? Do you have somebody to transport you? Do you have somebody to take care of any animals? So different things like that you can kind of talk through those conversations with them. Skilled nursing, although I did listen to a presentation the other day that they said that the average skilled nursing facility stay was 32 days. So although their plan covers them for days 1 through 20, what happens on those other days if the 32 days was the average? So again, coming in here and just selecting those different options for your client, what makes the most sense for them, and adding those different riders. You can see that with a hospital indemnity plan, that emergency room's automatically included. So they're going to get a little bit extra money too, because their copay is only $90. Ambulance rider, very affordable rider. Don't ever question whether or not to call 911 and ask for an ambulance. It is definitely life-saving. I always give this story when I'm talking about this rider and the importance of it when you're talking to your MA clients. Is I had an uncle who suffered a stroke, and he was so stubborn. He told his wife, I'm not paying my ambulance copay. We'll drive ourselves, and he lives in a very rural area. So by the time they got to the hospital, there was a lot of damage already done. And they said if you would have gotten help sooner, if you would have had an ambulance, they could have at least provided you some assistance in that ambulance ride. So again, just kind of talking them through that. They should never have to question a copay in order to get the help that they need. So great tool, a great tool. A lot of these different hospital indemnity plans also incorporate lump sum cancer riders or an extra vision rider if their particular plan doesn't have strong benefits for that. So you can kind of scroll through here and just, again, find the best plan and really customize it to them. And then adds in all the premium here at the top for that. So that's the hospital indemnity fill the gaps. This is the best way for you to cross-sell, the best way for you to talk to your clients about why they need it. And I just love the fact that you can see right here, clear as day, here are your copays. Let's find an option to help you with them. You can come up here, you can print, and you can save those in the upper right-hand corner as well. So that's the MA quoting, the hospital indemnity, fill the gaps. Let's now get into the enrollment side of it. And as we do, I'm just going to pull up my e-application here. How I got into this e-app, and I'm using a different account for this just so I can submit an application and then actually submit to the carrier, is when you run those quotes on the Medicare Advantage. This screen should look very familiar to you. You're going to see this Enroll Now button. So any carriers that we have on the enrollment platform, you'll see that Enroll Now button. All you have to do is click Enroll Now. The first time you hit Enroll Now, it will ask you to validate that you are contracted. So you'll have to either enter in your national producer number or your writing number. It does depend on the carrier on what they're asking. And then once you enter that in, it will verify your status, and then it will take you right into the application. So we're not redirecting you to the carrier's website. This is all staying on our platform. What's good about our e-application platform is if you're doing it for a Medicare Advantage or a Med Sup or a dental, it's going to have the same look and feel to it. So you'll always have your quote carrying over on the right-hand side. You'll always have your overview section where you'll have to go through each of these sections and complete them. You can complete the application out of order or hop around to a different section if you need to. So keep that in mind. I like the ease of coming back to a section or skipping a section if you're waiting for more information. And then we have the notifications tab. So as you're going through this application, if there's any errors, it will notify you in your notifications tab. So I'm going to walk through this application start to finish just to show you how easy it is to walk through. Now, submitting Medicare Advantage applications are pretty standard, so you're going to see, you know, the same questions that you're used to completing on these apps. Any of the carrier's required fields are on here as well. So what we're going to do is we're just going to go through this application. This is just saying that you have reviewed all the benefits and the summary of everything. We do have some CSG disclosures as well. And then you can just verify that before we start, do you understand all the benefits that we covered? Please confirm your selected plan displayed on the menu on the right-hand side and you're ready to enroll in your Humana plan. So once you have selected your plan over here on the right-hand side, you cannot change your plan once you're in the e-app. If you did notice you selected the wrong Humana plan, you will have to go back to the quote results screen and hit that Enroll Now. So once you're in the app, you can't change plans. And then we're going to go through the applicant information section right here. So first name, middle initial, last name, and then the date of birth, the gender, and then you can go into the phone number and then the email address. So if they are doing an electronic signature, you will have to have a valid email address. I'm going to type my email address in here for now, just so I can show you what that email process looks like if you are doing a remote signature. And then you would enter in their resident address. Carries over the zip code, the city, the state, and the county from the quote. Is the mailing address different? We're going to select no. Medicare number. And then your Medicare Part A and Part B effective dates. Do you know? Would you prefer no? And then we can go ahead and we can hit continue. So as you're going through the application, once you have completed a section, you hit that continue button and it will take you on to the next section. Once that section is complete, it will have a green check mark over there on the sections tab, letting you know that section has been completed. If there's a yellow error icon, that just means that there's missing information in that section or an error. So you can see I have that green check mark. The next is the election information, so you can just select what that is here. And then what's good about this section is it's going to notify you if you have any errors in that. So for example, this is an initial enrollment, but if I accidentally selected annual or special, and based upon the criteria that I then had to answer, if it was not accurate, the system would notify me and have that be changed. There are also some MA plans that have those supplemental benefits as with a cost to it. So if they wanted to add that in here, they can check mark that and then add that. So we do have that option in here as well. Existing coverage information. You can answer these questions accordingly. If you did answer yes, and there was more questions like the question about medical health coverage, it would automatically pull up additional sections that you would have to go through and complete. For demo purposes, I'm just going to select no to those and move on, but that's where you would enter in any of their existing coverage information. The physician information, this is going to be a little bit unique depending on the carrier that you are going to be doing your MA enrollment for. In this case, for Humana, we do have links out to their website to check what that provider number is. So for the companies, we'll have those links out there for you to quickly check and look up their member ID. Other companies that we have on the platform, they may have their system embedded within our system, so you can quickly search our system and then pull up so you're not being linked out. So it really just depends on the carrier and what that carrier preference is for us to use. So some you'll just type it in the system and select. Others you can go out and look for it on their website and then enter them in. Now again, as I'm going through this application, it is automatically saving, which is really nice. We know as you're going through applications, sometimes your phone rings or they have to let you go for some reason, or maybe you're waiting for additional information. Everything is automatically saving as you're going through it, so you can always come back into the application. I will show you where those incomplete applications store. This is asking if I am the author, if I am the legal representative taking this application, and since I'm saying that I'm working with the applicant, I'm going to go ahead and select no and then continue. Now the method of payment, you do have to capture the method of payment. That is a requirement by the carrier, even for those $0 a month premiums. So we do have all the different carriers payment options located within here. So however you want to pay for that, if that's coming from a checkings or a savings account, your routing number for the bank, you can either start by typing in the bank routing number and it will populate different options for you here. Otherwise, you can type in the bank name and it would also populate different options for you. And then first name and then last name on the account. Now, if a husband and wife is sharing their bank account, which a lot of times they do, just go ahead and put the applicant's first name in there. That's fine. You do not have to put both the husband and wife. And then we get into the to be completed by producer section. So this is where you would enter in your name, first and last name, your writing number, your phone number, and your email address. You will also provide that source of the lead. And then here's where we have links out to the health risk assessment. So this is always a popular question when we train on our Medicare Advantage e-app, is if we have that health risk assessment. So if the carrier has an external link to their health risk assessment, you will provide that link. All you have to do is click on that link. It will populate the window that you have to go in and sign into their health risk assessment, and then you can go through and you can complete that. So it just opens up in a new tab, sign in, you can complete it, submit that, and then you can finish your application. So whatever order the carriers are being lenient on not being submitted at the exact same time, because you have to do it in one system and then coming back into the application. So you can complete it in a different order if you'd like. The carriers are being respectful of that. So All of those links to complete the health risk assessment is located in that to be completed by producer section. So you'll notice we have all green check marks except on the optional supplemental benefits, just because we're not doing that one, but we can still go through and complete this. This is the summary of the enrollment data. So we're going to do a quick review, just making sure that we have everything accurate here. If we notice any errors in the application, all we have to do is hit this edit button and it will take us back to that section. Otherwise, we can just hit the section over here on the right-hand side to take us back. This is also your opportunity to print this off. So you can just hit this print button and it will provide you that opportunity to save it or to print it. You can just adjust that destination over there on the right-hand side. But this is going to be your summary of the application that you can keep for your record. This will also be available after you submit it, so you will have that option to obtain it afterwards as well. So from there, we're going to go ahead and hit lock and e-sign. And then after we do that, we'll just have to go through a couple disclaimers here, and then we can get into the signatures. This is just agreeing to all of the legal electronic consents. So just hit accept and then go ahead and hit continue. If you hit that print button, that's just printing all those disclosures out for you. All of the carrier's disclosures will be in there as well. All right, on to the signature. So we have 3 signature options, depending on if you're in the same physical location with the applicant or not. So if you are face-to-face with them, yay, you don't have to do any call recording. You can just select them in the same physical location as the applicant providing identification information. So when you have that selected, their signature is their mother's maiden name and the last 4 of their social security number. You would just hit apply e-signature and then sign application. So very easy to capture that signature if they're present with you. If they're not in the same physical location, maybe you're doing this over the phone, you can do the email signature or the text signature. Either option would work. I'm going to demo for you just so I can show you my screen. The email signature, keep in mind the text signature works the exact same way, except the link that you receive in your email and the verification code is going to a smartphone instead of an email address. So you can use either option. The screens that I show you will be the exact same. So it will automatically carry over the applicant's email address from the applicant information section, and then you can hit send for signature. This will also just say that it is it's pending the applicant's signature there. As that loads here, let me just show you what that looks. So now it says this application is now pending the applicant's signature. If you go to your view applications, this is where all of your applications store at. So any of your incomplete applications, so applications that you started, you're just either waiting for additional information or waiting to capture their signature. Also, any of your complete and submitted applications will also store in that e-applications panel as well. So you can see here, here's the application right here. It says producer signed, so we're still waiting for the applicant for it to say submitted. So you know it's been submitted when it has that green submitted button. Your incompletes, these are the ones that you've started, but you have not submitted them. So with the email and the text signature, they do have a 2-hour window to sign it. So this is where if you are past that 2-hour window and their verification code doesn't work anymore, you can resend the email to them with a new verification code. This is also if as they're going through it electronically, if they found any errors in it and they have to edit that's why we give you the option to edit. But if you edit it, it automatically voids that verification code that you sent them. So don't edit the application if you've already sent them the code unless they found an error in the application. So I'm going to go ahead and pull up the email that the applicant receives. The good thing about this is you are also copied in on it. So you have a copy of that, which is really nice to have. So this is what the email looks like. It will say, Humana Medicare Advantage e-application. This is where they have the link to click on and then the code. It also says that it is expiring in 2 hours, so they can copy that code, verify signature, and then they will have to enter in that verification code and then their date of birth. Remember, if they're doing this via text, it works the same way. Ooh, wow, that did not format for me. The date of birth also has to match the date of birth that you entered in the application. So if they enter in their date of birth and it's not verifying for them, a couple of things, check to make sure it was within that 2 hours, or you have their date of birth wrong on the application. So that's where you would have to go in and edit that. This is the same disclosures that you agree to on the previous screen, so they can read through those and accept, and then hit continue. And then they will have that same screen here as you had on yours, where you were able to review the application. So this is where they would just go through, verify that plan, all of the information that was taken. They do have the option to also print this or save it. So if they hit print, it gives you that option to save or print. And then all they have to do is click sign application. So once they hit sign application, it will then go into the screen where it's preparing the application. Some carriers we submit in real time, so it will say submitted. Thank you for submitting your Medicare Advantage application to Humana. Other carriers, we send them in batches and overnight. So it may say pending submission, and then the next day when you come in, it will change over to submitted. So you're either going to get a submission pending if we're doing overnight batches, or submitted if we're doing it in real time. So there will be a difference there. So when you go back into your e-applications panel, if you reload this page here, it will automatically show you that the status has changed. Once it's done loading here. So now my status says submitted, and then I can view a copy of that summary of the application if I click on view here. Now, we do ask for a 24-hour window for all of the application data to show up on that carrier's agent portal, but everything will transfer over to that agent portal, so you can always check the statuses of any of the applications that you submit on their systems. So that's what the e-app looks like. Jeff, did we have any questions come in on the e-app process? Or even the coding?
I had looked just about 10 minutes ago, didn't have anything, but let's take a look.
Okay.
Nothing so far. All right. Well, maybe you did such a good job on that, and then, yeah, that was no question at this point.
Okay.
Nice stuff. I like it. I don't see
it really makes, yeah, it really are. If you haven't used our e-application platform, what I like most about it, and you can see here as I look at my e-applications that I've submitted, is you can submit your dental, you can submit your med sup, you can now submit your Medicare Advantage. So we do have multiple carriers on our e-application platform, and that Medicare Advantage app that I just walked through is going to look the exact same as the Med Sup. It's just going to have the Med Sup questions instead of the MA questions. So if you're used to filling out that application screen one time, the second time, the third time, it's so easy to go through. I personally think it's super user friendly too, of just being able to hop around different sections. You don't have to be hitting the back button or hitting the back arrow. You can navigate quickly to different sections if you need to.
Yeah, you did pretty fast. I mean, it took you about 10, 12 minutes while you were demoing everything. I can't imagine if you just had to just enroll someone, you'd probably do that in less than 5 minutes.
Yeah, it's very, very easy to go through.
Right. Yeah, so I was impressed with that. Yeah.
And A lot of agents ask, and this is kind of common questions I always get about practicing, or, can I get into a demo environment? What I always tell agents is we don't have a dedicated testing environment for you to do test apps. But what I do tell agents to do is go ahead, hit that enroll now button, get your information validated. That way, the next time you go and hit enroll now, the system just automatically carries you into it, so you can bypass that. And then what you can do is you can get familiar with the screens. So you can go through the app and just kind of get familiar with the different sections and the questions, and then just don't submit it. So maybe you've gone through a couple of sections. Once you get to that signature portion, get out of it, come back into here, delete that test. That way you can get familiar with it and get used to it, but don't go through and actually submit one. Or
And we
call
got
us and we're
I had
happy
a
to
question
walk through.
come in, Anna. It's kind of a
Yeah.
little bit not maybe related to that, but it's CSG related. He wants to know if he wants to move some of his carriers into this. Like, he wants to now maybe get licensed with one of Integrity's companies so he has access to this. How long does it take, or how's that process work as far as if he wants to, I'll just give an example myself. He wants to move, I don't know, his Cigna contract from one marketer to another marketer. Does the new marketer then, I guess, give you guys information? How long does it take to load that in, or how long would that take?
Yeah, so it depends on the product. So if you're talking about Medicare supplements, you have to be contracted with that carrier in order to get into the application. So if you're already contracted with that carrier, you have your writing number, you have your NPN already, it doesn't matter if you're moving them around at all. But if you're newer, so like let's say you want to get contracted with Allstate, and you reach out to GoldenCare to get contracted, you get all your contracting submitted through Allstate. We ask for a next day. So if all your contracting is done, once everything's been approved, you get your writing number, everything's good, wait until the next day to then try to use CSG, just because we get a feed from the carriers, the carrier
I
system
understand.
updates.
So you're getting it from the carriers, then they'll send you out. Here's who we've gotten now. I don't know, 73 new med sub agents that we've gotten. They'll shoot. Okay.
Yep.
All
And then
right.
the Medicare Advantage works a little bit differently. So the Medicare Advantage, you do have to have your contract through an Integrity upline to do our e-applications on our system. So just make sure that your upline updates all of their ready to sell files that they send to Integrity.
Gotcha. Okay. Well, I'm glad that I asked that. I'm glad that question was asked then. Okay.
Yes.
So thank you for that.
Mhm.
Well, you know what? I know that you kind of cover what you wanted to cover today, Anna.
Yeah. Yep.
Good.
I think, yeah.
Great timing. Yeah. I with all the webinars that go on, some of the ones that go on for an hour, I think get to be so long, but I'm so glad that, it's 2:45. So what a great topic, great timing. I'm not, let's see if I'll go back and check more time on questions here. Yeah, you
I
did
know.
such a good job that the folks are all, I don't know, very well informed.
Good.
Well,
Good.
listen,
Good.
I want to thank you, Anna, for just going through this again. And yeah, I know there are so many tools, and just for my own endorsement, I mean, I don't know, I do a lot of recruiting and training at GoldenCare, but I still end up writing a lot of Medicare supplements because I have aunts, uncles, friends. Once you kind of get into the Medicare arena, it's really hard to get out. You have kind of
Right.
uncles, friends that are all counting on you. So I end up getting certified with all these companies. I write in, I don't know, a handful of states, and I tell you, just myself, I use CSG a lot. It simplifies everything. And I like your point, Anna, of saying, look, it's nice with one place that you can do all your med sups one place. Well, I like the idea of doing my med sup, my med advantage, my dental, and my hospital indemnity now all in one place with preloaded client stuff. So as you know,
Right.
for the integrity folks out there, CSG can also be linked, through Medicare Center. So it's all coming together. And so I think it's a great tool. If you aren't using CSG more, like Anna said, log on there, maybe just open it up, try to enroll a couple companies, play around with it. But a bunch of thanks for you, Anna, and anyone that wants to call us, has questions about this, moving products, etc. Or I know that Lynn will be sending out a copy of this broadcast. I think we'll probably record this on our website for anyone that maybe wants to re-listen to this or share it with someone else. It's available at goldencareagent.com under our recordings of all of our webinars. So with that, I guess I'll just thank Anna and let everyone go. Give us a
Yes.
call from
Thank you so
marketing
much.
office. Go ahead, Anna.
Oh, I just said thank you again for your time. And if you have any questions as you're going through the application, never hesitate to reach out to us for
Right.
assistance.
Right. Yeah. And it's the marketing office here at GoldenCare, 800-842-7799 if you need anything. Thanks a lot, Anna. Good luck selling this fall, everyone, and give us a call if we can help.
Check out our website, goldencareagent.com, or give us a call at 800-842-7799.